In today's video, I, a practical nurse, will be trying to decipher or read out handwritten medical prescriptions. Let's see if I can read what these doctors are writing. What's up, you guys, and welcome back to my channel. For those of you who are already subscribed and part of the family, thank you so much for joining me here again, and thank you so much for your support. I appreciate you guys so much. For those of you who are new, welcome. My name is Kiara Selena. I'm a practical nurse, and on today's video, I'm gonna be deciphering doctor's orders. Yes, doctor's orders. I'm gonna sit here and take all the credit for this video because it is definitely inspired by a guy that you guys probably already know, some of you. He is a doctor here on YouTube. His channel name is Dr. Hope's Sick Notes, I believe. He is a medical doctor, and he did a video where he was trying to decipher some prescriptions that were handwritten prescriptions that he found online, and I thought that was pretty cool because reading prescriptions as a nurse is a huge part of our job. You will definitely see handwritten prescriptions, all types of prescriptions, and I just thought it would be fun to, you know, brush up on my pharmacology a little bit. So for all of my nurses, nursing students, and aspiring nursing students, this is definitely going to be a good review for us. I want to see if I'm going to be able to not only decipher this writing or these prescriptions, but see if I'm able to recognize all of the medications that I'm going to see. To make this video a bit more funny and a little more real, I did not hand select these prescriptions or these doctor's orders. I asked my sister to go online and try to find some doctor's orders and send them to me, and I will try to guess them. So I have not seen any of these prescriptions yet. So everything you guys are gonna see, the reactions you guys are gonna see are like, they're real. This is the first time I'm seeing all of these. So without further ado, let's get into the video. Let's see how good our pharmacology is, and let's see how good we are at deciphering doctor's orders. Okay, so the first one we have here, usually on a prescription, it'll say like RX or something on top. It won't just be written on like any blank sheet, but you can see that there is it was cut out, like this picture was cut out. So maybe it's on top. But anyway, let's see. So it says meme. That looks like memes. You can't lie, that looks like memes. I don't know what that says, but it says very light, 0 meds left. I think that's what it says, left. PSP Lyrapo. I have no idea what that is. No idea. Slim. What is O/E? I don't know if this is like, I don't know what this is, but it says no IUD string seen. Okay, so this is for an IUD. And IUD hook used. Okay, IUD hook used. And then ultrasound to check position of IUD. Okay, so I guess somebody got an IUD put in. This is not a prescription. I would say this is more a doctor's note. So yeah, this is probably like a note that the doctor wrote like in the note section. It is not a prescription because I don't see any medication on here. So I'm gonna go with that. Let's go to the next one. So I'm really happy she chose this next one because it is very well written. Obviously that's kind of gonna take away from the fun of me trying to decipher the note, but I think it'll still be good review for my nursing students. You guys might learn a couple things if you guys haven't done pharmacology yet, or even if you guys have done pharmacology. So we have amoxicillin plus clavulanic acid, 500 mgs, right? So amoxicillin, if you guys looked at my pharmacology video, one of the tricks, I have a couple tricks that I use in order for me to kind of get an idea of what a drug is, even if I have never seen it before, and that's by using prefixes or suffixes. There's like little tricks. Cillin, whenever you hear something that ends in cillin, a lot of the times it will probably be an antibiotic. Cillin or sin, so you have erythromycin, amoxicillin, penicillin, anything sin will usually be an antibiotic. Amoxicillin is something that I am familiar with. Amoxicillin, especially if you're working with elderly people, you will see a lot, especially if some of your patients have catheters. You know that people with catheters are at risk of urinary tract infections, and that is something that you see very, very often in the elderly community. People get urinary tract infections, they get confusions. You do a dipstick and it usually tests positive. So doctors will usually prescribe amoxicillin for that. So I know that that is an antibiotic. And then clavulanic acid, I've heard of that before. I've never given it, so I don't really know exactly what it is, but I think it's supposed to aid in antibiotic resistance. Let's Google that. I think it's supposed to aid in clavulanic acid. So it can overcome antibiotic resistance in bacteria that secretes B-lactamase, which otherwise inactivates most penicillins. So I knew it was something along those lines. So we have amoxicillin plus clavulanic acid, 500 mg. So we know that 500 mg is the prescription. However, the tablets are only available in 125 mg tabs. So to all my nursing students out there, pause this video and go down in the comments below and comment how many tablets are you going to give this person. They have to get 500 mgs and the tablets are only available in 125 mg tabs. I think you guys can do that. I'm gonna give you guys a couple seconds to do that. And the answer should be 4, right? 125 times 2 is 250, 250 times 2 is 500. Simple.
2 plus 2 is 4, minus 1, that's 3, quick math.
And then it says take one with food every 8 hours for 7 days. That's usually how long antibiotics are prescribed for. They'll usually be prescribed for 7 days or 10 days. 10 days you see in certain situations, but it's between 7 and 10 days. That's usually the normal time for antibiotics. And then down below we have a paracetamol. And I said that with my British accent because here in Canada, I have never, ever seen a doctor prescribe paracetamol. My best friend is British, so I'm always hearing her talk about paracetamol. Oh my gosh, I've got a headache, got to take paracetamol. Anyway, so I know that it is definitely in like the Tylenol family. It's the same thing as Tylenol, it's acetaminophen, but they call it paracetamol and we call it Tylenol. I'm sure we have paracetamol here, but like I personally have never, ever seen a doctor actually write paracetamol like on a prescription. Never. It's always Tylenol or acetaminophen, always. And then we have 500 mg tabs, which usually Tylenol comes in like, well, you can find Tylenol that comes in 5 mg tabs. They are available in 5 mg tabs. And it says take one with food every 4 hours as needed for fever, right? So that's one thing that you'll see a lot. A lot of people will have like standing orders. I think that's what they're called. Well, there's usually collective orders, which is basically a book where there are prescriptions that you can use in emergency situations for everyone unless they have an allergy. So if you are unable to get a hold of a doctor or whatever, you can go in the collective orders and get that. But a lot of times, especially in the elderly community, that's mainly where I have worked, everyone will have PRN Tylenol. Every single patient will have PRN Tylenol just in case they get a headache or something. It's just something that doctors do. So you will see this a lot. And the Tylenols aren't always prescribed for fever. It can also be for pain. I guess it depends on the Tylenol. So, all right. So next here we have from the Medical Center Hospital. That does not sound real. For Vagus Roman, that's the person's name. The address is blocked. But anyway, you have Perdil. That's what it looks like. I have never heard of that medication. Let's search it up. Perdil. That's what it says, right? Perdil medication. No. So even Google doesn't really know what this is. It's saying furosemide, but I know that it is not furosemide, because I think furosemide is Lasix. Yeah. And no, Perdil is definitely not the name for furosemide. So I don't know what that is, but the person has 20 mgs of Perdil. PO. PO means by mouth for all my nursing students. The next one is ferrous sulfate, which I am very familiar with. Once again, it is something that you see very, very often in the elderly population. Ferrous sulfate is just a fancy name for iron. In your body, you have red blood cells. You have a whole bunch of different types of blood cells, but you have red blood cells, which is responsible for basically carrying oxygen throughout your body. And in your red blood cells, you have a protein called hemoglobin, right? And iron helps your body produce hemoglobin, which is, once again, the protein in your red blood cells that helps with carrying oxygen throughout your body. And then you have humulin N, which is a type of insulin. So you have ferrous sulfate, 300 mgs, PO. PO once again means by mouth, and TID. TID is a term that you guys will see. Definitely you guys are gonna see this. You have DIE, which means once a day, BID, which means twice a day, and TID, which means 3 times a day. So this person is getting 3 mgs by mouth of ferrous sulfate 3 times a day. And then that C with the dash on top means with, so with meals. And then the last one is humulin N, which is insulin. For those of you who are not familiar with insulin, it is just a medication that is given to diabetic patients to help them regulate their sugar levels. So humulin N, 30 units. SQ. SQ means subcutaneous. So you have 3 different types of injections. Well, I wouldn't say injections. I'll call them pokes that you can give. You have intravenous, which goes into the vein. You can either administer solution or medication, depending on what the situation is. You have subcutaneous, which is into the fat, but not into the muscle. So before the muscle, it's just into the fat. You see that for diabetic patients, we'll do it a lot behind the arm and this fatty area right here. So SQ means subcutaneous, so into the fat, subcutaneous tissue. And then you have intramuscular, which goes into the muscle. So those are the 3 different types of pokes or injections that you can give. This one, or not this one. Insulin is usually given sub-Q all the time. Let's go to the next one. I have no idea what this is. This is not even girl. Not even, that is not a medical prescription, because with a prescription you would at least see numbers, because when a doctor prescribes a medication, they have to write the name of the medication, but they also have to write the dose, and they have to write how long this patient is going to be on it for, and I don't even see numbers on here. Nothing. So this is not a prescription. This is just something weird that somebody put on the internet. I see labor. I see the word labor. And I think I see invert. So did this person have a heart attack while giving birth? Oh my God. So I really think that says, wait, hold on. Child, I can't. That is it for today's video. She sent me a whole bunch of other pictures, but they were more letters than prescriptions, so I wasn't gonna waste my time and your time with those, right? We want this to be educational, but still fun. I had a lot of fun making this video, so if you guys had a lot of fun watching, please make sure you like and share. Somebody out there might benefit from the information. Maybe a nursing student might need the review. You never know, but please make sure you like and share. And if you are not yet part of my family, please make sure you do so by subscribing, and most importantly, turning your notification bell on so you will be notified whenever I post future content. Because if you don't and I post new content and you want to see my stuff and you're not getting the notifications, well then how are you gonna know that I put a video out, right? So make sure you put that notification bell on, and I really hope to see all of you guys in my next one. Bye.